Hi, everybody. How's everyone doing today? I hope you're all doing well during this holiday season, as well as could be expected. I'm going to start talking about healthcare. It's important, of course, very important. And seeing that December 31st is coming real fast and millions of people are going to lose their health insurance benefits because they won't renew the ACA subsidy, it's sad. It's very sad. Just another struggle that we're going to have to figure out with the Trump administration. And you know what I'm going to talk about? I'm going to talk about universal health care. Oh, God, I know. Whoa. People freak out when you talk about universal health care. Educate yourselves. Do the research. Find out what it's really all about before you're like, oh, my taxes, you're going to get taxed so much, you're going to have to pay this and that, and you're not going to get this benefit and that. That's not accurate. I mean, I'll try to educate you on it. Like, let's go with the Netherlands, okay? They have universal health care. They call it the Health Insurance Fund. And it is $185 per month. Yes, you do have to pay 7.75% income tax on top of that $185. But you'd be amazed how much that 7.75% is. Pleasantly amazed. And children under the age of 18, they're free. You don't pay for children. And you can increase your benefits at any time. Like the $185 covers basic doctor's visits, hospital stays, prescriptions, your basic services like that. And then if you want to add a few extra, I don't know what else you would add, but a few extra things, then you can pay more if you want. And you also have a $450 a year deductible. That's unheard of in the United States. I once had a health insurance policy that was $10,000 a year for the deductible. That's a lot. And so I just had that insurance in case of something catastrophic, because I had to pay out of pocket for everything else. So if you took, like, let's be fair, like $50,000 salary per year. So if you had a $50,000 salary per year in the Netherlands, you're paying $185 for the basic insurance, that's per month, along with $323 per month is 7.75%. Along with the deductible, if you use it during that year, it's $34 per month. So you add all those up, and you get $542 a month in health insurance premiums. How many of you pay more than that? A lot more than that. And that also includes some other things, like, let's see, I'm going to read off of all these. You can get long-term care that provides intensive long-term care and support for individuals who need continuous supervision or 24-hour care due to, like, severe physical, mental, or sensory limitations, disabilities. This typically would include elderly people in nursing homes, people with severe disabilities, or those with chronic mental health conditions. Then there's social support that you'll get. That helps people participate in society and stay at home longer. It includes household help, transportation services, home adaptations, mobility aids. That's like wheelchairs and those little scooters. Let's see, daytime care and activities and support for caregivers. Then there's support and help and care for children and youth under the age of 18. And remember, you don't pay premiums for that. It includes preventative services, youth health clinics, support for parenting programs, mental health care for children, um, programs for children with disabilities, and child protective services. Mm-hmm. But you see, health insurance is mandatory for everyone in the Netherlands. It's like our car insurance is mandatory. You have to have it. Cops pull you over, you better show them the insurance. And but it all goes on your income. So as far as the 7.75% goes, it could be lower. You just got to apply. And this is so that everyone participates. All citizens participate. And the funding of this plan then is shared by every resident. Everybody's funding it. No matter if you're poor, you're wealthy, everybody's funding it. So that everybody can get care. The Dutch healthcare system is heavily governed by the Ministry of Health, Welfare, and Sport. So it's not a system where you could sit around without a job like you can in the United States in certain cases and get what would be the equivalent of Medicaid. You can't do that in the Netherlands. The Dutch government mandates that all residents over the age of 18 take out that basic health plan. And if you don't, you'll be fined. And they'll track you down. And if you don't pay those fines, then your pay, if you're working, will be garnished. Or if you get any kind of benefits from anywhere, they'll garnish them for the price of this healthcare plan. So that everybody's still paying something. There's also a government allowance system. So if you can't pay, you're a senior, you're disabled, you're just impoverished, you don't have much money, they'll work with you. And did you know that the United States is the only developed country in the world that doesn't have universal health care? Everybody else does. Why don't we? Aren't we some kind of powerhouse or whatever? No. What we are is we are number one. We're number one in the highest healthcare premiums for insurance. We're number one in the price of prescriptions. We're number one in the cost of out-of-pocket that we have to pay. We're number one with the highest administrative overhead, which that means we pay the CEOs of these insurance companies millions. The lobbyists for these insurance companies, millions. And a little guy that works at the insurance company making $15 an hour, maybe 16. They're doing all the work. They're doing all the grunt work. And we're just making these insurance companies, pharmaceuticals, and everybody else richer and richer. That's the American way now. If you don't agree with that, do your research. And for those of you who don't even agree with the research, forget about it. Stay off my channel. Anyways, this is something that I'm going to continue to talk about. And I hope you're all doing very well and that you will be happy this holiday season. And try to make it as pleasant as you can. Until later, see ya.